Well, good afternoon, everyone. Welcome to our training on today. And we are so glad to come to share our information about Count the Kicks and Healthy Birthday. So, welcome to our Safe Babies with Us, a guide to talking to expectant parents about fetal movement monitoring. I would like to thank the Alabama Public Health Department for this training on today. A few housekeeping items. You are on mute, so you won't be able to say anything. But if you do have any questions, towards the end, I'll definitely be answering any questions that you would put in the chat. So once we get toward the end, definitely let me know if you have any questions and I'll be able to monitor the chat then. My name is Stephanie Moody, and I'm the Health Equity Coordinator with Healthy Birthday Count the Kicks. Here at Healthy Birthday, we have a laser focus on stillbirth prevention, but we also focus on eliminating the racial disparities that exist and persist. As you know, statistics show that Black women are 2 times more likely to lose their child to stillbirth and 3 to 4 times more likely to die while giving birth. My responsibility is to look at the inequities in birth outcomes in your state and develop strategies to address it. Part of the strategy is to build partnerships with community organizations that serve within the marginalized communities so that we're not only educating the expectant parents, but also educating the providers, the doulas, the midwives, home health and maternal health workers. Our goal is to work together with those who are the boots on the ground, getting the information into the hands of those who are most impacted by stillbirth, moving us to a place where race is no longer a predictor of stillbirth. My passion for this work in stillbirth prevention came after finding out about the inequities that persist in stillbirth outcomes within the African American community. My passion for the fight against preventable stillbirth and equity comes from the impact that stillbirth had on our family after my sister Angie lost her daughter Jasmine to stillbirth in the early 90s. While we were working on the campaign to educate the faith-based leaders and community leaders here in Des Moines, Iowa, my son and daughter-in-law became pregnant. And so I asked his wife, Courtney, if she had heard about the Count the Kicks app, and she used it. Well, on her due date, Courtney thought that she was in labor, but noticed Luna wasn't moving as much as she usually was. Originally, when she called her doctor, they had told her to drink water, lay on her left side, time the contractions, all of the things that they would tell a first time mom. And there are times that we can feel a little anxious about giving birth, but Courtney decided to go into the emergency room anyway. The reason she decided to do that is because she noticed that the information that was in the app was showing that there was a reduction in Luna's movements. So she was able to provide her doctor, the doctor that was on staff, with information that she had from tracking Luna's movements. And she was able to prove that Luna wasn't moving like normal. They ended up examining her and they found that there were 2 health issues that would have prevented our Luna from having a healthy birthday. Since then, I've continued to educate and empower expectant parents and maternal health workers on the importance of counting as well as tracking their fetal movements. Saving babies, yes, this is my dream job, and I am honored to be here today with you and to share this information with you all. Miss Luna, as you can see on the screen, she is now 2 years old. And those were her birthday pictures. And she is now a big sister to her little brother, Ramare. Now, one of the most powerful and effective ways that we found to educate expectant parents is through our use of mom-to-mom sharing. Through the testimonies of those whose children were saved from counting and tracking their fetal movements in the 3rd trimester, we've seen a ripple effect, helping expectant parents know how they can use this life-saving tool called the Count the Kicks app. This baby safe story was shared on Good Morning America, and it's about baby Ruby. Let's listen to her mom, Eileen, and how she saved baby Ruby's life by using our app.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
We are still hearing the testimonies from the ripple effect of baby Ruby's story to this day. Stories like these are reminders of why we do what we do each and every day. Now, I'm sure that you'll all probably know these definitions, but I like to go over them to ensure everyone on the webinar is on the same page. I always like to start by sharing the differences in the definitions of stillbirth, miscarriage, and infant mortality, but more importantly, the statistics associated with them. You would be surprised at the number of maternal health workers who are unaware of the differences between stillbirth and infant mortality. Stillbirth is the loss of a baby after 20 weeks of pregnancy. On average, we lose nationally about 23,500 babies to stillbirth. Miscarriage is the loss of a baby before 20 weeks of pregnancy. And infant mortality is the death of an infant before his or her first birthday. Now, on average, we lose around 2,200 infants every year before their first birthday. But notice that the stillbirth rate is still slightly higher. So we must recognize that it is just as prevalent as infant mortality, yet no one is talking about it. If you ask expectant parents about the Back to Sleep campaign, most can explain what it is. Now, this is not to speak down about these campaigns because they're both necessary. The point I'm trying to make today is that we're losing too many babies in both situations, and there are preventative measures that exist for both and should be discussed by OBs, doulas, midwives, maternal health workers everywhere. Excuse me. It should be just as common to share stillbirth prevention methods with expectant parents as it is to talk about taking prenatal vitamins. The only way to impact these losses is by starting with awareness and moving to solution. Our Count the Kicks app is a viable solution to reduction of the stillbirth rates, and we're going to show you how. So here's a graphic representation showing how stillbirth in this country compares to infant death. As far as number of babies lost, as you can see, again, stillbirth is just as prevalent as infant mortality. So it's really important that we begin talking about it and that we understand the solutions that there are to reducing preventable stillbirth. The likely causes and contributors of stillbirth identified by the study is listed below in the order from most common to least common. So the causes that they have found in the study is that number one, pregnancy and labor complications. This is problems with the pregnancy that's likely caused almost, 1 in 3 stillbirths. These complications included preterm labor, pregnancy with twins or triplets, and the separation of the placenta from the womb, also called placental abruption. The placenta provides the nutrients and oxygen to the fetus. Pregnancy and labor complications were more common causes of stillbirths before 24 weeks. Another one is problems with the placenta. Almost 1 in 4 stillbirths were likely caused by problems with the placenta. One example of a placental problem that causes stillbirth is insufficient blood flow to the placenta. In the FCRN study, placental problems were the leading cause of stillbirths that took place before birth, and these deaths tended to occur after 24 weeks of pregnancy. So with my sister, as I shared earlier, when she lost her daughter, Jasmine, the issue that she had was actually an issue with the cord. The cord was too short. And so as Jasmine was trying to come through the birth canal, what was happening is her cord was stretching and then it was reducing that blood flow. And unfortunately, Jasmine was born still. Another is birth defects. In more than 1 of every 10 stillbirths, the fetus had a genetic or a structural birth defect that probably or possibly caused the death. Then there's infections. In more than 1 of every 10 stillbirths, the death was likely caused either by an infection in the fetus or in the placenta or by a serious infection in the mom. Infections were a more common cause of death in stillbirths before 24 weeks and than those that came after. Problems with the umbilical cord. They were considered a probable or possible cause of about 1 in 10 stillbirths. For example, the cord can get a knot in it or it can be squeezed, cutting off the oxygen to the developing fetus. This cause of stillbirth tends to occur more toward the end of the pregnancy. High blood pressure disorders in the mother, whether due to chronic high blood pressure or preeclampsia, also contributed to stillbirths. These types of stillbirth were more common in the end of the 2nd trimester and the beginning of the 3rd, compared with other parts of the pregnancy. And then medical complications in the mom. Problems with the mother's health, such as diabetes, were considered a probable or possible cause in fewer than 1 in 10 stillbirths. So let's look at the national stillbirth data first, and then we're going to go ahead and drill down and look at Alabama's stillbirth rates. Nationally, 1 in 169 pregnancies end in stillbirth, but racial disparities exist and persist. For Black moms, we are losing 1 in 96. This means that Black moms are twice as likely to lose their baby to stillbirth when compared to their white peer, friend, or neighbor. Hispanic moms lose 1 in 199, Indigenous moms 1 in 138, white moms 1 in 204, Asian Pacific Islanders 1 in 233. What we need to understand is that, again, it is just as prevalent as infant mortality, and families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. So here are the rates for Alabama. The blue line represents the United States stillbirth rates, and the red line is Alabama's trends. And notice that Alabama is trending way above the national rate. If we look at the 5-year average in Alabama, we're losing 8.85 babies per 1,000 live births. That means 1 out of every 113 pregnancies ends in stillbirth, which is approximately 527 babies and over 1,000 parents that are affected by stillbirth in Alabama every year. Now, these are the statistics for Iowa. This data shows the life of our campaign. The red line at the top represents the national stillbirth rate, and the dots in trend line beneath it is our Iowa rate, and that's starting in 2003 and going through 2020. Where the blue dot meets the red line at the top is 2008. That is the year that our campaign actually began. You can see the trend line goes down from there. One important thing to note is that the majority of the United States has remained pretty stagnant, whereas Iowa's rate has continued to decrease. Of course, there's some years it fluctuates, but it's important to look at data yearly as well as on averages. There are many outside factors that could cause a spike in stillbirth outcomes, like a large outbreak of syphilis or even COVID-19. There are a variety of factors that could lead to an increase or decrease in the state's stillbirth rate. But one important takeaway in Iowa is that when risk factors like the smoking rate and obesity rate have increased during this time frame, our stillbirth rate still saw a steady decline, while the rest of the country has remained stagnant. Since the launch of our campaign, our laser focus on educating and addressing the inequities that exist and persist in stillbirth outcomes, we have seen a 32% reduction in the stillbirth rate in Iowa and a 39% reduction in the stillbirth rate for Black women in Iowa. That is fantastic. And we want to bring that same reduction to the stillbirth rates in Alabama. Our 2020 preliminary rates show that we are down to 4.0 fetal deaths per live births. This is the second lowest Iowa stillbirth rate on record after the 2018 rate, and it is one of the lowest in the United States. By working together to educate expectant parents as well as all maternal health workers on counting and tracking fetal movement in the third trimester, we can not only impact lives, but together we can save lives. The bottom line is we are better together. So as mentioned on the prior slide, there's a large divide when it comes to those who are more likely to experience a stillbirth. I wanted to take a moment to share what research has shown to be some other contributing factors to the racial disparities in stillbirth outcomes that persist. Here at Healthy Birthday, we review a lot of research articles, and these points come from various articles that we would be happy to share with you if you are interested. The question is, why are there such large disparities when it comes to stillbirth outcomes? Research shows that there's a lot of contributing factors to the racial health disparities in stillbirth. Researchers point to the following as causes for the disparities that exist and persist in stillbirth outcomes for Black expectant parents. Systemic racism. When policies, practices, representations, and norms work together to perpetuate racial inequality. Examples can include higher infant mortality rates, less school funding, harsher punishment for crimes, and even less income. Toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African American woman in a systemically unjust society and all that comes with it, have led to real and pervasive health issues for Black women. Epigenetics. Physiological variations that are caused by external or environmental factors that switch genes on and off and affect how cells read genes instead of being caused by changes in the DNA sequence. A predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. There's also lack of access to healthcare and socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby to stillbirth than a high school-educated white woman. So you may wonder, what are we doing as Count the Kicks to reduce disparities in stillbirth outcomes? One of the things that we've done is we've hired me as the health equity coordinator on staff to ensure that we're looking at everything we do with that equity lens. My responsibility, again, is to look at the inequities in the birth outcomes in all of the different states that we partner with, and then to develop those strategies to address the inequities. We want to make sure that we get to the different providers, the doulas, the midwives, the home health workers, the maternal health workers. That way we can educate each and every one of them so that they can educate the expectant parents in those partnering states. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. One of the ways we utilize funding is we translate our app and our brochures to meet the needs of those who are in the states that we partner with. If they don't speak English, we want to make sure that we get that information in their language and into their hands. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We work within marginalized communities by improving our programming based on the lived experiences that are shared with us by women of color. As we learn more about the issues that they encounter, we identify solutions and we work with our partners on implementation of these solutions. Our app is also in 12 languages, and then we have culturally appropriate educational materials. We even have low literacy brochures for those where English may not be their first language or they have an issue with reading. They're more picture based for those who struggle with reading. We also have created videos featuring women of color so that they're able to connect with the face that they see on the screen, as well as updated our printed and educational materials and frequently asked questions, all in multiple languages. So part of our equity work includes ensuring that our messaging connects with those who are most affected by stillbirth. This is a video of licensed therapist Brianne Ward, who is the CEO and founder of Forward Consulting. Let's watch as she shares about the importance of expectant parents counting and tracking their baby's fetal movements in the third trimester.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the third trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today.
It's through these types of videos that people are able to connect with the face that they see and realize that this is a true issue that definitely needs to be addressed and can be addressed through educating expectant parents on how to count their fetal movements and track their fetal movements in the third trimester. So this is the research article that started the entire campaign. A group of physicians did a clinical study and determined tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Dr. Ruth Fritz, who is an assistant professor in the Department of Obstetrics and Gynecology at Harvard Medical School, and who is now a part of our medical advisory board, she said babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern, starting at 28 weeks, and they are empowered to speak up if they notice a change. These are just some of the experts who agree that tracking fetal movements provides expectant parents with that mind fetalness, the knowing of what is normal for their baby, what is their baby's pattern, and it also increases bonding with their baby as well. One of the greatest misconceptions is the belief that the use of the app is going to cause some anxiety in pregnant women. Des Moines University and the Harkin Institute did a study, and their results showed that a reduced rate in stillbirth showed a excuse me, and their results show a reduced rate in stillbirth for those who use the app in comparison to those who didn't use the app earlier in pregnancies. The most common comment on our app shows that 98% of our app users say that the opposite actually happened when they used the app because they were less concerned through use of the app. It gave them the right information because they have objective information versus subjective information. My sister, when she lost her baby, the only thing that she could tell her doctor, because this was prior to Count the Kicks app being invented, so she could only say, I have a feeling that something is wrong. She couldn't tell them exactly what it was. She couldn't tell why it was feeling like something was wrong. She didn't have objective information. Imagine if she had had the app with the data to prove what she was experiencing. Jasmine could possibly still be here today, just like Luna is. Our app helps you as a provider to have quantifiable objective data, to have those conversations with the expectant parent. You will always have expectant parents that are worried about something, but the app provides that reassurance that is needed. They can look at the app and recognize when there really is a difference. With the right education, like using the Count the Kicks app, they would be less likely to contact you because they know versus feel. The reason we provide expectant parents with any information is because we want to give them preventative care. And by using the Count the Kicks app, it is preventative care. Some additional benefits to fetal movement monitoring include reduction in preterm birth rate. Fetal growth restrictions are identified earlier, and women who have stillbirths are substantially higher at risk for severe maternal morbidity than women who have live births, regardless of the cause of the fetal death. Our app has no cost, but benefits parents and unborn children by alerting them when there is a reduction in fetal movement. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. There are several other key research studies that you can review. They can also be found on our website at www.countthekicks.org. So the next step is identifying how to implement Count the Kicks with your clients or your patients, how to teach them to actually utilize the app. So we've looked at stillbirth and the research behind counting and tracking fetal movement in the third trimester. Now I want to dive into exactly what Count the Kicks is and how to use the app. Count the Kicks is our evidence-based stillbirth prevention public health campaign that educates expectant parents on the importance of tracking fetal movement in the third trimester. Our app is an early warning system, providing parents with the data that empowers them to speak up to their provider if there is a concern. Our stillbirth prevention campaign, known as Count the Kicks, came about when 5 Iowa moms endured the heartache of losing their daughters to stillbirth or infant death in the early 2000s. They were connected through friends and pastors, and they had many conversations over coffee, and the women decided to turn their grief into stillbirth prevention efforts to keep other families from facing the pain of losing a baby. In 2004, they worked with the Iowa legislature to create Iowa's stillbirth registry to begin collecting data specifically around stillbirth. A few years later, they attended a public health conference in Norway where they talked about seeing a 30% reduction in stillbirth by teaching pregnant women how to monitor their fetal movement during the third trimester of pregnancy by doing kick counting sessions on a daily basis. So we didn't create kick counting, but we created the tools, the app to help parents get it done. After the conference, they came back inspired by the research with a desire to see that same reduction in stillbirth rates, and together they birthed Count the Kicks. I'm sure that everyone would agree stillbirth is not a subject that anyone is excited to talk about. We're not hanging out at family picnics talking about stillbirth rates. This is why you'll notice when you look at our materials, they are fun, they are bright, they're colorful, empowering. This is exactly what the founders wanted. It's focused, educating expectant parents on the importance of tracking fetal movement in the third trimester. We have both a mobile app and paper charts on our website for those who do not have access to a mobile device or maybe they struggle with access to the internet. We know that 1 in 3 at-risk babies can be saved simply by teaching expectant parents to use our free Count the Kicks app in the third trimester. We have proof that it is highly effective because we've seen that same reduction in the stillbirth rates here in Iowa through implementation of Count the Kicks. So our app is free. It's available in 12 languages. It's available on both Apple and Android products. They would simply download the app, create a profile, and get ready to count those kicks. To get started, we want them to sit with their feet up or lie on their side. When they register on the app, it's going to ask if they would like to count for single babies or twins. And then if they choose twins, the kick counting session will include 2 buttons. One button counts the movements of baby A, and the other button is going to count the movements of baby B. They would just slide back and forth between the 2 babies as the baby kicks or moves. Whether it's a kick, a roll, or a jab, it doesn't matter. They get to count all of them, including rolls. The only thing they don't count is hiccups because hiccups are involuntary. So you want to count each of the baby's movements as 1 kick, and you simply tap the app button. Now, this will be the only time you're going to hear me say this. I usually would not tell someone to multitask in the middle of a presentation, but for this, I would love if you would go ahead and download the app so that you can actually see how easy it is to use. So you go ahead and you would tap the little baby foot, just as you see in the upper right-hand corner on the screen here, each time you feel a movement. After a few days, you're going to begin to see a pattern for what the baby is doing, how long it takes this baby to get to 10 movements. Every baby is different. Some will move faster, some will move slower to get to 10 kicks. And the key is knowing what is right for your baby. So in the example on the screen, you're going to see that this baby takes right around 15 minutes to get to 10 kicks. Now, most of the time, it could take less than a half hour, but it could take as long as 2 hours. Being a mother of 5, I had 3 boys who were born 13 months apart. I know what it feels like to be really busy. So let's say that mom is in the middle of a kick counting session and they've got a potty training toddler who disrupts the kick counting session. You can restart the session once you're finished taking care of baby who is trying to potty train. Or if you accidentally track a kick twice, you can actually delete the kick that you accidentally tracked. Again, we're mom focused. So most moms are busy all the time. And for me, pregnancy brain was a real thing, right? So we've created a daily reminder system that tells you when it's time to start your kick counting session again. You can save your kick counting sessions in the app and see what your baby's movement history is. That kick counting history can be useful for when mom goes to visit with their provider. They can share it with their spouses or partners. They can share it with their family members and friends. The app is going to take that guesswork out of knowing how long it takes for their baby to get to 10 movements, and they can log their times if they don't have ability to utilize the app on that downloadable kick counting chart if they don't have access to a mobile device or the internet. The app also tracks future pregnancies for us so that you don't have to create a new account with each pregnancy. And your account can also be managed on multiple devices. So as you see, we are now available on Apple Smartwatch. So you can count on your Apple Smartwatch, or you can grab your cell phone. If you've got it in your hand and your smartwatch is charging somewhere, you can do it on multiple devices. This is just an example of what our user sees after a few times of using the app. The app shows that the last 5 sessions on the table, and a user can download the entire kick counting session history or send it to themselves or to their provider at any time. You can see that from this chart, again, this baby's taking right around 15 minutes every day to get to 10 minutes. We also have those paper charts. This is what they look like in case they don't have access to a smart device or they have broadband issues. We also have a new strength tracking feature. Research shows that expectant parents should also be paying attention to the strength of their baby's movements while counting and tracking their kicks. With our new strength tracking feature, at the end of each kick counting session, you'll be asked to rate the strength of the baby's movement. If their baby's movements become weaker, it can be a sign that baby needs to be evaluated. This new feature teaches us how to judge the strength of the baby's movement. You can rate your sessions from fluttery to fierce. Fluttery are going to be the light movements that are hard to see from the outside, similar to what is felt when you start feeling the baby move around. Fierce is going to be the real strong movements where you can visibly see that baby is moving around on the inside. It can feel like a limb is literally going to poke out of your belly. Simply rate the strength of your kick counting session by selecting fluttery, which is indicated by 1 footprint, up to fierce, which is 5 footprints. You can include a note detailing how the session went and what you may have noticed during the session. This note just says, baby felt strong like normal. Once you finalize the session, you'll see a graph showing your strength average as well as the average time it takes for the baby to get to 10 kicks. If you notice a significant increase in the average time where it's taken baby to get to 10, or a decrease in the strength of baby's movements, we would want to inform the expectant parent to contact their provider. Reduction in fetal movement, again, can also signal anything from low amniotic fluid or ruptured amniotic sac or even a tangled umbilical cord. If a provider's office is closed, tell them the hospitals are open 24/7 and they're ready to serve them. The risk of not speaking up outweighs the risk of not going in. Here's a short video showing how easy it is to use our app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
The beautiful young lady in that video just so happens to be my niece. As you can see, it's easy to use. It takes the guesswork out of remembering how long it takes, and it empowers moms to speak up if there is a change. Now that you know more about Count the Kicks and about our app, the next step is to figure out how to integrate Count the Kicks into your practice. It's so easy, and we've created everything that you need to easily have this conversation with your patients or clients. We know and understand that talking about stillbirth is not something anyone wants to do, but it is so important. Expectant parents hear about all sorts of different things that can help their baby. We talk about the importance of taking folate supplements or not drinking alcohol. This conversation should be part of your routine exam with expectant parents. Some of the things we hear are, I don't want to scare moms. Pregnancy is full of risks that we talk to moms about all the time. Stillbirth is just another risk that moms deserve to be educated about. Some people think stillbirth just happens. There's nothing we can do. That's not true. There can be warning signs if moms know what to look for. What about her baby is always active? It's not a concern. Babies are active until they aren't. Cord and placental accidents can be sudden. Moms need to know what's normal so they can notice a change. There can be warning signs if moms know what to look for. We also hear she's almost at her due date. The risk of stillbirth actually increases as a mom approaches or exceeds her due date. Other misconceptions we have encountered include babies move less the closer to their due date. Babies don't move less. They might move differently. You may feel less sharp kicking and more rolling. However, if you're monitoring the baby's movements at the same time each day, it should take about the same time to feel 10 movements. Another misconception is, I can hear baby's heartbeat on a Doppler device, so I don't need to worry about movement. A change in the baby's heartbeat is one of the last things to occur when a baby is in distress, whereas decreased movement is an early sign. Another misconception is baby's just getting ready for birth and they're running out of room. Babies should continue to move up to and during birth. We also hear mom should get 10 kicks in 2 hours. This is a common misconception and very outdated information. What research now states is that moms should be focusing on fetal movement in general and understanding their baby's pattern, knowing what's normal for their baby. The next one is only high-risk expectant women should do this. No, all women all women should do this. We don't only do the glucose test for high-risk women, and a lot of women who do have stillbirths had no other risk factors. We also hear that triage doesn't need this information. Labor and delivery triage is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. So a common question that is asked, when and how do I talk with my clients about Count the Kicks? So the when, 26 weeks, we want them to start counting fetal movements in the third trimester. So 28 weeks for a normal pregnancy, 20 weeks if they are high risk or if they're carrying multiples. The next step is how to discuss it. I always suggest downloading the app yourself so that you can see how easy it is to use it and you can answer those questions that your clients may have. You can ask a question to your clients like, do you know about the importance of tracking your baby's movements? You can follow it up with the benefits of knowing what is normal for their baby and how it actually increases bonding and reduces anxiety. Or you can say, let's talk about how to track your baby's movements. Share how movements are going to be those jabs, those rolls, pushes, anything but hiccups, because again, hiccups are involuntary. Have them to download the Count the Kicks app. A helpful tip, one of the best times to have them to download it is when they're waiting on that glucose test. This is a perfect time to download the app, set up their account, and begin playing with it. Other ways to integrate Count the Kicks into your practice or your organization is to use a form at check-in. Ask on your intake form if they know about counting their baby's fetal movements in the third trimester. Have all of your front desk staff trained to ask patients to fill out a form that provides them with the information to download the app. You can use our QR code if you would like to make this step even easier. During that glucose test, after the check-in and the labs, have nurses talk about the app and ask patients to download it while they wait and then walk them through how to use this app. You can also add a question to the electronic medical health records that pops up in the third trimester to remind you to ask your patients or your clients about tracking fetal movement in the third trimester. This is an example of a form that we developed to help doctors' offices and other maternal health organizations to integrate Count the Kicks into their practices. We simply give it to them and they have their patients or clients to fill out the form, and they can detach the side of it, and then the patient or client can hang it on their refrigerator. It has pertinent information for them, such as their doctor's name, their phone number, their address, and where they plan on delivering. One of our partners, Celebrate One Columbus, has integrated Count the Kicks into their intake process by simply asking their patients on their form if they have downloaded the Count the Kicks app. This is a simple and easy way to implement Count the Kicks into your system and start educating your clients and expectant parents on counting and tracking their baby's fetal movements in the third trimester. We also have videos in English and in Spanish. Here's another video that you can use to show your clients or patients.
Count the Kicks is a great way to monitor your baby's well-being, which is why many doctors recommend making this part of your daily routine at 28 weeks or 26 weeks if you're high risk. It's easy to do using our free Count the Kicks app. Just pick a time when your baby is active, preferably the same time every day. Sit with your feet up or lie on your side. Count each movement as one kick by tapping the footprint on the screen, and the app will show you how long it takes to reach 10. You'll soon get to know what's normal for your baby. If you notice a change in the strength of your baby's movements or how long it takes to get to 10, contact your healthcare provider right away. The Count the Kicks app is free and available in 12 languages. Our app makes it easy to track and save each day's kick counting session. You can even email or text your sessions to your provider or family. Don't delay. Visit the App Store to download Count the Kicks today. And remember, every kick counts.
So remember, when you're talking with moms about fetal movement monitoring, you want to stress the importance of knowing their baby's normal and speaking up if there's a change. We want to make sure that mom knows what number to call if she has a concern. We want to send a brochure home with mom and or an app card. And all of these things are free to you, and I'll show you how to order them here shortly. You want to share with mom that research shows evening is usually the best time to count baby's movements. Tell mom that the provider, Tell mom that their provider should be asking about baby's movements every appointment in the third trimester. They should be asking things like, tell me about your baby's movements. How is tracking your baby's movements going? Can you show me your Count the Kicks graph? What questions do you have about your baby's movements? These are very simple questions that can be asked during these appointments, just to ensure that mom is being mindful about counting and tracking fetal movements in the third trimester. If you're dealing with a mom who has endured a previous stillbirth, you'll want to follow the same protocol. Just because it's happened, we can't shy away from the conversation, as uncomfortable as it may be. There's a tool that can help to reduce the fear and anxiety of being pregnant again, and that is our Count the Kicks app. Since women who have had a stillbirth are more likely to experience another stillbirth, we want to talk about starting to track baby's movements at 26 weeks versus 28 weeks. Feel free to talk about the previous stillbirth and acknowledge that their child was born still. Ask about the name of the child, the gender if you weren't their previous doctor or provider. Stay away from medical terms like fetal demise. You want to be empathetic and let them know that you care, that you're listening, and that you're there. Ask if anyone has talked about the importance of tracking fetal movement before. A lot of moms that we talk to have had previous live births have stated they were never told about the importance of tracking fetal movement. We have resources for you that are available to you, and they are free for you to order due to our partnership with the Alabama Department of Public Health. So part of these educational materials include promo posters in English and in Spanish. There are how-to posters that are also in English and in Spanish. We have app reminder cards and also brochures that you can send with your clients. All you have to do is go to www.countthekicks.org and click on order materials, fill your cart, and choose Alabama as your state, and then leave. It gets sent right to you. It's free of charge. There's no charge for shipping, and those items will be delivered directly to the address that you put in the system. It's super simple. And one of the things that I love about these presentations is the number of orders that come in during and after. You can place these in your restroom. You can put them in the patient or client rooms. Keep them in your car if you drive around to go and see the families. It's really easy. All you have to do again is visit www.countthekicks.org. Click on materials, click on your state, fill your shopping cart, check out. They're free for you. Another great resource are our Count the Kick ambassadors. These are women across the nation that are working hard to share our Count the Kicks education and messaging throughout their state. There are volunteers that can help with a variety of things like presentations, similar to what I'm sharing today. In your state, you are lucky because you have 2 ambassadors. Jasmine Hammonds was supposed to present with me on today, and unfortunately she had a little one who wasn't feeling very well and was unable to come. But we also have Amy Dodds Ray, and they would be happy to connect with you. They're willing to help share about Count the Kicks, participate in baby fairs once COVID slows down and it's safe to meet again, or any other things that you would like them to join into. Maybe it's a team meeting, or you want them to talk about Count the Kicks and implementation of Count the Kicks in your practice. Whatever it is, they are there, ready, and available. So what are the next steps? The next step, download that app. And then you want to practice, practice, practice. This way, you're going to be able to show your patients and your clients how easy it is for you to use the app and to know what's normal for their baby. Make sure to share this information with your teammates. Order those materials. One tip we always give is you want to designate someone in your office to oversee ordering the materials. It usually takes about a week, maybe a week and a half, depending on where you are and how your mail systems run. So check those materials. You have an idea of how many expectant parents come into your office or how many you see on a regular basis. Make sure that you put that order in so that you never run out. We also have an online continuing ed training that is worth 1.5 continuing ed credits. And you actually would go to cme.dmu.edu/safe-babies, and you'll be able to take that training for free as well. Our baby safe stories are right there on our website, and it provides powerful insight on the importance of tracking fetal movement in the 3rd trimester. This is a quote from Yeli, which is Eva's mom. She said, "I am very grateful that Count the Kicks made me aware of the importance of paying close attention to my baby's movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all the expecting moms out there. Happy and healthy deliveries to everyone." This is why we do what we do. We have 75 stories that we know about, and we're still counting. It's stories like these that you're about to watch that will change your life forever. This is the story about a baby saved baby Nala. Let's hear her mother Dana's experience as she shares about counting kicks in the 3rd trimester.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. Well, I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. Just pay attention, seriously, like it's your baby's life.
It's stories like these that help us to understand the importance of having that conversation about counting fetal movements in the third trimester, tracking fetal movements in the third trimester, and knowing what is normal for your baby. The last thing that I would like to share with you is that I want to invite you to join us on October 21st at 1 p.m. We are going to be having a webinar, and it is entitled COVID-19 plus pregnancy, how to improve outcomes in a global pandemic. We're going to discuss the impact of the pandemic on prenatal care and explore trends in birth outcomes for expectant parents with COVID-19. We will also share evidence about the safety and effectiveness of COVID-19 vaccinations during pregnancy and hear from a new mom about her experience with pregnancy during the pandemic. We will also be joined by Ashley Smoots of the CDC, and she is part of the Pregnancy and Infant Linked Outcomes team and the COVID-19 response team. So I want to thank you so much for taking the time to be with me on today and partake in this training so that you can help us to save babies in your area. If you have any questions, now would be a great time to pop those questions into the chat, and I'll be able to answer those questions for you. Otherwise, if you would like to connect with me, you can connect with me by sending me an email at moody.stephanie@healthybirthday.org. Again, that's moody.stephanie@healthybirthday.org. And I'm looking through to see if there are any questions that were put in the chat. Thank you so much, Samil. All right, so Cynthia, your question was, how can we get a copy of the how-to video? The how-to video is actually right on our website. We have a provider academy and even a parent academy. So if you direct your parents to our website, they'll be able to go right there and see the how-to video. Thank you, Fayetta, for saying that this was an excellent presentation. What other questions can I answer for you? All right. I want to thank you all so much for joining me again on today. It has been wonderful. Oh, here we go. Do moms count only one time a day? Yes, they can count one time a day, but if they're feeling like something's a little off, it's not going to hurt anything to track more than one time a day. Perfect. Thank you, Cynthia. All right. Well, thank you so much for joining me on today. And I look forward to saving babies with you. If there's anything further that I can do, any other presentations, maybe to train your your team or to train those who work within your practice so that you can better serve your patients and clients, I will be glad to assist. Have a great day, and thank you so much.